Hello, here I'll talk about female fertility preservation. What is fertility preservation? It is the process of saving or protecting eggs, embryos, or ovarian tissue so that a person can use them to have biological children in the future. Having children may not be your priority right now, but it can be important for some of you later. In our center, we offer fertility preservation service to those whose future fertility might be affected by treatment for cancer or other medical conditions, and that includes surgery, chemotherapy, or radiotherapy. I will go through some frequently asked questions about female fertility preservation. A woman is born with all the eggs that she has for life. The number gets smaller when you become older. Some cancer treatment can reduce or damage eggs and affect your ability to have children. The top image here shows an image of the ovary before cancer treatment. The dark circles are follicles containing the eggs. In the lower image, you can see reduced number of follicles after cancer treatment. You may be able to have your own children with the help of fertility treatment in the future if you freeze eggs or embryos before receiving cancer treatment. There are several methods available for fertility preservation in women. These include freezing eggs or embryos, medications to protect the ovaries during chemotherapy, freezing of whole or part of an ovary containing immature eggs, or surgery to change the position of the ovaries. Not all women starting cancer treatment will need to consider these options. The decision of whether to pursue fertility preservation is a personal one. I will go through the different options. Egg freezing is suitable for women who are unmarried currently, or for those who are married but have religious or ethical objections to embryo freezing. Your husband will not be able to use the frozen eggs if you pass away. Even though you may be unmarried now, you must be legally married later if you come back for further fertility treatment after recovery. Embryo freezing can be considered for women who are already legally married. However, the embryos cannot be used without your husband's consent or if the marital relationship comes to an end. You or your husband will not be able to use the frozen embryos if one of you pass away. There are medications that may be able to protect your ovaries during chemotherapy. They can be given by monthly or 3-monthly injections, depending on the preparation during the course of chemotherapy. The drug may help to reduce blood supply to the ovaries and may protect against damage to the eggs from chemotherapy. The efficacy is yet still to be determined by more research. Side effects of the medication include hot flushes, night sweats, headaches, mood swings, and vaginal dryness. If you are planning to receive radiation therapy to the pelvis, you can consider a surgical procedure to move the ovaries out of the pelvis. This aims to lower the amount of radiation your ovaries are exposed to and can be done by laparoscopy under general anesthesia. There are risks of anesthesia and the operation. Comparing the different methods of fertility preservation, with egg freezing or embryo freezing, the time required is 10 to 14 days. There are costs involved with the procedures and the storage, and for both procedures, there is sufficient evidence recommending them. The technique is also mature. With embryo freezing, one has to be currently legally married, and the partner cannot be changed. With GnRH agonist, the medication that may be able to protect the ovaries during chemotherapy, it is usually given 1 to 2 weeks before chemotherapy and continued until treatment is completed. The cost of the medication is several thousands, but the evidence currently is still insufficient. With ovarian tissue freezing, it could be done within days if facilities are available. The evidence is sufficient, but the technique in our center is still immature and is currently not being offered as a clinical service. This diagram shows how ovarian stimulation and egg collection are done. Ovarian stimulation takes an average of 11 days, during which you will receive injections every day so that the follicles in your ovaries will grow. You will have ultrasound during this time to monitor the growth of your follicles. When the follicles are big enough, you will receive another injection to mature the eggs. Egg collection will be arranged, and the procedure is performed through the vagina. If you are freezing eggs, the mature eggs collected will be frozen. If you are freezing embryos, the eggs collected will be fertilized with your husband's sperms before freezing. Here we can see in more details the egg collection procedure. The procedure is performed under ultrasound guidance. The ultrasound probe is placed in the vagina, and the aspiration needle passes through the vagina into the ovaries. The fluid in the follicles are collected, and the embryologist will then look under the microscope to see if there are any eggs in them. Not all follicles will contain eggs. Ovarian stimulation can be associated with some possible complications. Ovarian hyperstimulation syndrome usually presents with abdominal distension, vomiting, ovarian cysts, and there can be fluid in the abdomen and the lung. Ovarian stimulation may also increase the risk of ovarian cancer, but the evidence is not conclusive. This is usually limited to patients with endometriosis. This slide shows more of what happens in ovarian hyperstimulation syndrome. The ovaries are much enlarged because of ovarian hyperstimulation. There can be fluid in the lungs and the abdomen. The patient may experience nausea, shortness of breath, abdominal distension, and reduced urine output. Ovarian hyperstimulation syndrome is potentially dangerous. The mild cases usually resolve by itself with time, but serious cases may require hospitalization and further procedures. The egg collection procedure is also associated with possible complications, although overall they are rare. These may include intra-abdominal bleeding, pelvic infection, pelvic organ injury, and severe pain requiring hospitalization. If complications occur, these can delay your cancer treatment. At the clinic, you will meet our fertility specialist who will ask you some questions about your medical conditions and related issues. If you decide to proceed to freeze eggs, you will need to sign a consent form. If you are younger than 18 years old, your parents will need to sign the consent form together. We will also perform a transvaginal ultrasound scan prior to the start of ovarian stimulation. This will give us more information to plan the treatment and the number of eggs that we can expect to be collected. You can contact us to make an appointment for further discussion when your cancer treatment is complete and you are at a stage when you want to make babies. Some women can achieve pregnancy naturally after cancer treatment without fertility treatment. It is not advisable to conceive a baby too soon after completing cancer treatment because of the possibility of cancer recurrence and effects of chemotherapy on your eggs. You should always talk to your oncologist first before planning a pregnancy. If you want to use the frozen eggs to make babies in the future, you must be married before fertility treatment. You and your husband can be referred to our fertility clinic when you have plans for babies. We will thaw your eggs, which will be fertilized with your husband's sperms in the laboratory using a procedure called intracytoplasmic sperm injection, which is injecting a single sperm into each mature egg. A single embryo is replaced into the womb each time. Here you can see the in vitro fertilization procedure. The egg is fertilized with the sperm using XC to form embryos. The embryo is then replaced into the womb. There are limits as to how long you can store your frozen eggs in the laboratory. At a maximum, the frozen eggs can be stored until you are 55 years old or for 10 years, whichever is later. You can also specify an age limit lower than 55 years or a maximum period of shorter than 10 years. The contract is renewed every 2 years, and the frozen eggs will be discarded if you fail to renew the contract. You can inform the center anytime if you do not want to continue with the storage of frozen eggs or embryos and would like to terminate the storage contract. We offer a public fertility preservation service for women at Queen Mary Hospital. There are certain selection criteria, as stated here, for you to be eligible to be seen as a public patient. If you do not fulfill these criteria, but would still like to consider egg or embryo freezing, you can be seen as a private patient and we can discuss more on this. Even as a public patient for fertility preservation, there are some costs for the egg or embryo freezing procedure and storage. If you would like to arrange egg or embryo freezing, you can download a referral form from our website and ask your cancer doctor to refer you to us. We will try to arrange an appointment within 1 week. For more information, you can visit our website where there is a section on fertility preservation. You can also visit our pages on Facebook and Instagram